Oral health is a serious issue. In the U.S., dental care is the most common unmet health need. Oral cancer causes 8,000 deaths a year. The #1 chronic disease of childhood is not asthma, not diabetes, it is an oral disease. This epidemic affects people of every age, in all walks of life.
In my job, I have a high-level overview of this issue, and that's my job. But it really comes down to a very personal issue for me. I grew up surrounded by disparities and people not having the type of health care that they needed to have. When you experience those types of things and you see that people are not receiving the kind of care that they need and really deserve, and to know how this will impact their lives in a very meaningful way, it makes it personal. And it brings it down to that level as we have to do as much as possible with the tools and resources that we have to bring health care, not just oral health care, but health care and optimal oral health to all people.
Having poor oral health can lead to numerous of problems, and particularly chronic infections. It can lead to poor quality of life.
Many people still don't know about the importance of oral health to overall health, and don't know the amount of suffering that some people are encountering with not having access to oral health services and children not having access to preventive services.
We had one particular patient who had an abscess of his tooth that actually resulted in difficulty with his airway. He spent 5 days in the ICU because he had some difficulty with breathing, as well as a serious infection that extended from his tooth down into his jawbone. Ultimately, the patient suffered dearly from neglect from actual oral hygiene care.
When you go a long time without dental care, you lack the education. And a lot of times that education is just, oh, floss your teeth once a day, brush twice a day, use Listerine, very simple things.
I was very surprised that it was a simple solution, because I thought maybe I had to have teeth pulled and stuff, and I didn't know it was, just as simple as a gum infection, and it comes from, not just not taking care of the teeth properly.
If you don't get the education, you don't know that that's preventative care.
I took it, her directions when she explained, because she told me, broke it down and told me exactly what was going on with my mouth, and that I can do some things to take care of myself.
Even medications we take to keep us healthy can compromise our oral health, putting us all at risk for oral health problems. One of the most common side effects from medication, xerostomia, or dry mouth.
Dry mouth is called xerostomia, and it can impact patients in a couple of ways. Xerostomia is where there's a lack of saliva. Saliva is a protectant for teeth against tooth decay, and we need that lubrication to protect against tooth decay. Also, the mucosa becomes dry and friable, so patients with xerostomia stop wearing sometimes their prosthetics, their dentures and their partial dentures, because it's too painful to wear them. And so if you have xerostomia and you have it for a while, the decay rate can rapidly increase, and you can have a disaster on your hands, especially for people that are elderly and may have kind of limited their home health care a bit. Then you can really have a recipe for disaster.
Well, there are actually over 500 medications that can cause oral health care problems. We most commonly see things like antidepressants, antihypertensives, antihistamines, and the over-the-counter products. If you look at those categories alone, you'll see that most every American is taking one of those products, and so they're at risk.
When prescribing medications to my patients, I often want a complete and thorough medication list. As you know, with some patients, we don't always get that. So often, I have to call the pharmacist and talk to them. If not, send emails in regards to patient prescriptions. And that we find is very open line of communication is very helpful with making sure the patients do not have side effects from medications.
A complete list of medications is so important for patients because they may use one pharmacy, but they're seeing multiple physicians and dentists, and maybe going even to urgent care clinics. And so we tend to be the one central location where that complete medication list is compiled, and that needs to be distributed to other healthcare professionals.
The good news is, whatever your role on the healthcare team, you can make a real difference in the fight for oral health.
The strength of the interprofessional approach is to go beyond our boundaries, to actually integrate health across all areas. And this needs to work both ways, not only for physicians and physician assistants and nurses and others, pharmacists, to be concerned about oral health, but for oral health practitioners to be concerned with overall health, do blood pressure checks, hemoglobin A1Cs, and so forth. So it needs to work both ways so we have a coordinated, integrated, interprofessional approach to health.
When I'm educating a patient with diabetes, I always go through a top 10 list for those patients to discuss their disease as well as their medication management. 2 of that top 10 have to do with oral health care.
One way I actually try to help patients is help them to realize that their oral cavity is just as important as their diabetes, is just as important as their high blood pressure, and help them to understand the dynamics of routine follow-ups with their dentist and knowing that that's equally important. So I think if we help the patient more aware of how oral health affects their entire body by educating them, by showing them different types of things that they can do at home to help with their oral hygiene, I think that would actually help our patients to realize that the oral cavity is just as important as all their other health issues.
Oral health affects social, physical, psychological, and economic health in profound ways sometimes. And we have a big challenge in our country. We have much further to go. It's going to take the work of everyone working together to not only improve oral health, but by improving oral health, improving overall health.
By promoting oral health in healthcare education and in practice, you can help arrest and reverse this epidemic. The tools you need to start are free. There's the online educational program Smiles for Life, and other resources from organizations like the National Interprofessional Initiative on Oral Health. They are working with healthcare providers just like you to change how we all think about oral health and to work together to improve not just the health of our patients, but to change their lives.